back pain. And I've had quite a lot of messages already from people who've seen our post from yesterday saying that they're quite looking forward to it because back pain is really common. And I was saying before you joined, as a GP, it's something I see pretty much daily, if not at least 2 or 3 times a week. And so I guess we wanted to join together for a live tonight to have a chat about our own experiences in helping our patients through their own back pain and flares of back pain. And I know you have a huge amount of experience. Do you want to introduce yourself as well?
Yeah, I will. For those of you that don't know me, I am Emma Levy. I'm a physiotherapist. My private practice is called Elevate Physio and Performance. We are based in Finchley Central, North London. And when I'm not at the practice, I work with the Team GB athletes. So I have experience of working with the kind of high-level sportsmen with back pain, to the kind of 90-year-old man with back pain. So a whole kind of spectrum of experience treating back pain. And like you said, it's a massive burden. I think lower back pain is like the single leading cause of disability globally. So yeah, I see a lot of back pain in my clinic.
Okay, so I guess the first question I'd always ask you is, and I know the answer from my experience, but is there like a typical presentation? Is there one thing that you're used to seeing, or is it completely variable?
It's totally variable, to be honest. It's not one size fits all, and I will always kind of treat what I see. So it's unfortunately it's not one size fits all. Everyone is different. Everyone has a different presentation.
Okay, when people come in to see me as a GP, a lot of the time, they've been reading online. People are very educated nowadays, and they've been online and they've seen that certain injuries can happen to discs and muscles, and they often want to know exactly what it is and what's going on. And we discuss usually doing a scan or something like that. How important is it? Let's say you've just had your first episode of back pain and you're a young person. How important is it to have a scan or know exactly what's causing the pain?
Yeah, so okay, this is a big question because we get a lot of young people coming in, and the first thing they say to me is, can I get a scan? Okay, now this is my typical answer. So there's been lots and lots of studies, and what they've done is they've taken MRIs of thousands of people. Okay, so over 3,000 people they've done an MRI. And these people have no pain. Okay, so these are pain-free people that they've plucked off the street, and they've MRI'd over 3,000 of them. And a massive percentage of these pain-free people have disc bulges and degenerative discs. And the big percentage I'm talking about, kind of when you get to kind of 60, 70, 80s, we're talking about 80% of these pain-free people have disc bulges or disc degeneration. So my argument to patients is you can have abnormal findings on an MRI scan, but no pain. So if you're coming to me with pain and we organise you an MRI scan, that MRI scan isn't necessarily going to tell me something that I don't know already, because I expect you to probably have disc degeneration or a disc bulge, and that's not going to change your treatment plan. So I would often dissuade someone away from having a scan unless there are a few factors which would indicate me sending them to a doctor or to A&E to have a scan.
Are you talking about kind of back pain red flags there, or kind of warning signs? Should we go through those together?
So the main things that would be an indication for a scan is if the patient has had a trauma, so if they've fallen over or had a road traffic accident or something. If they had a positive neurology, like worsening neurological symptoms, so things kind of going down both legs, like pins and needles, numbness down their legs. If they had any new bowel or bladder disturbances. If they had any kind of symptoms in their saddle region, so that's kind of in between their legs, like where you wipe your bum after going to the toilet. And if they kind of were generally unwell, if they had they'd lost a lot of weight recently, or if they had things like past histories of cancers,
Yeah.
and I was thinking about something more sinister going on. But
Yeah.
otherwise, a scan doesn't normally change our treatment.
That's a really important one. And I think that you're absolutely right. I mean, if you're suffering from a new episode of back pain, it is always important to see a medical professional, either an experienced physiotherapist or a doctor, because there are some what we call in the profession red flags, which are things you might worry about. For example, if you've had a history of cancer, cancer can spread to the spine, and so any new presentation of back pain would be something quite worrying. So I completely agree. Do you find that scans can sometimes actually hinder, so make people quite focused on the injury?
Yeah, definitely. And that's again where it's our role to educate the patient. So if a patient comes to me with a scan and it says disc degeneration or disc bulges or similar findings like that, then the first thing I will do is talk to them and spend time explaining what I've just gone through about the fact that even though they have these findings on their scan, it doesn't necessarily mean that that is the reason why they are in pain. And our role as a physio can often, the most important thing that we can do sometimes is literally educate that patient. And I spend a lot of time talking to back pain patients. So, you know, you'd be surprised how like a kind of large proportion of that clinic time as a physio can be spent talking and educating patients.
So I guess one of the questions that I'm really keen to know as a GP. So let's say I've seen someone for back pain for the first time. They're a young person. They don't have there's no kind of red flags for me, and they're in a lot of pain, and they always ask me, what should or shouldn't I be doing? And
Yeah.
I guess on a on a superficial level as a GP, I'm happy to advise that the old school idea of lying on your back, yeah, and doing nothing is not good, and also kind of maintaining activity is good, but not going crazy. But other than that, I normally defer to a physiotherapist for advice. So what would you say to someone who is suffering with their first episode of back pain, and
Mm-hmm.
wants to know how active should I be and what do I need to avoid?
Yeah. So I tend to treat acute incident of back pain like any other acute musculoskeletal injury. So in my head, I'll be thinking about the police principle. So protection. So protection will be right. I don't want you to do anything that really, really, really aggravates it. So don't go and do your run like you were planning to. The O is about optimal, so the O and the L is optimal loading. Okay, so this basically means that we actually don't, like you said, Dan, we don't want patients with back pain to go and lie down on their back anymore, particularly. We want them to move, but we want them to move optimally. Okay, so the difficult bit with that is sometimes it's my job to try and encourage a patient who's in a lot of pain to try and move, which is quite difficult. And sometimes this is where I'll swing it back to you as the GP and say, right, can you help manage the pain that this patient is in through analgesia? But we'll come back to that. Because then I think ice. So potentially if it's an acute injury, then they could be using ice for pain relief. It's a natural pain reliever. I mean, compression isn't necessarily kind of appropriate around the back, but as a physio, I might tape it sometimes because that kind of offloads it a little bit. And again, the elevation part is more for kind of a distal injury. But that's kind of my thinking. So throwing it back to you now for the analgesia aspect.
Yeah, I just wanted to ask one other question on that, and that is that what about the heat versus ice? Because a lot of people, and in some ways, I advise my patients often to use heat to break spasm in the lower back. But I know that, but ice is often advised. What's the role of heat and cool in back pain?
Yeah. Yeah, again, it's quite a tricky one because ice will sometimes make muscle spasm worse, and heat is really good for muscle spasm. But if there is like an acute inflammation, I wouldn't necessarily want to throw heat at it. So what I'll sometimes say to the patient is, look, try them both at separate intervals and see which one helps more. And whichever one helps more, use that one.
But so neither of them are going to do any significant harm, really. It's more unlikely to. It's more
Not
it's
really.
more just about seeing what works for you. So
Exactly.
so yeah, I think the question about analgesia is good, pain relief is good, and I think my attitude to it has changed a bit over time. I think when I was a kind of medical student, I had more of a get on with it approach, but as I've learned more and I did a stint in anesthetics and so on, I think my appreciation of the importance of good pain relief to break the pain
Mhm.
cycle and allow people to get their activity and their mobility back. And I also think giving people a window without pain psychologically allows them to focus on recovery rather than focus on the pain, which unfortunately can put you in a bit of a negative cycle which perpetuates itself. So what I always advise my patients is pain is always managed according to a pain ladder, a stepwise ladder, starting with the weakest pain relievers and then moving up gradually to stronger ones. It's important to say anyone should really check their medical history and check with their doctor before taking a specific pain reliever, because even things like ibuprofen have various contraindications, and there's some people who can't take ibuprofen for medical reasons. But generally, I would start with something like paracetamol plus ibuprofen. Usually that actually has quite a significant effect for most people. And what I would say to most of them is, especially people who give up quickly, is don't see this as supposed to do 100%. I would say if you're taking a paracetamol and ibuprofen and you're getting 40% pain relief, I'm happy with that. That's 40%. That's not nothing. And then let's see what we add in on top of that.
Yeah.
After that, it does get a little bit tricky because we move more towards opioid type painkillers like codeine and tramadol. There is a lot of evidence now that they don't have much of a role in back pain, and they can lead to kind of chronic problems and chronic dependence and things like that. So we are quite careful nowadays with it. I think it's very difficult because you see a patient who's in excruciating pain in front of you, which back pain can do, and they're not able to work and so on. Then you often kind of feel that you really want to do something. But if a doctor was to use a strong painkiller like codeine or tramadol, they would use it ideally for the shortest period of time. And probably if I was escalating to the tramadol level, I'd immediately be thinking about referring the patient on as well to someone, because I'd be that to me would be a flag about the significance, that how bad the pain actually was. What do you see in your patients in terms of who takes pain relief and who doesn't, and people's beliefs around pain relief? How does
Yeah.
that affect your ability to help them?
Yeah. Well, I personally, I support obviously a patient's beliefs, but I will often try and encourage them that if their GP has prescribed them pain relief, I will encourage them to take it, because like you said, it gives them this window. And it's this window of slightly reduced pain that might enable them to get going a little bit. And just a little bit of moving, a little bit of mobility, a little bit of, going for a walk, getting some fresh air, moving your joints, moving your muscles will just allow them to take that next step forward.
Yeah.
So if a GP has prescribed pain relief and they don't want to take it, I try and kind of to tell them the positive aspects.
Yeah.
A lot of people don't like taking pain relief, do they?
Yeah, no, I agree. It's about exploring beliefs. So you can't just, as a GP, and I think if you're being holistic and patient-centered, you don't just tell someone to do something. You try and explore what they might want to do, what might be helpful for them. Because ultimately, if someone wants to brave it without pain relief, then that's fine. But I think our job as professionals is to try and show them where our experience is, and where we've seen better results, possibly.
Yeah.
Coming back to the flags, I would say, I think in medicine there's always this idea of red flags, the cancer red flags, the back pain red flags, which is this, this idea of the things that mustn't be missed because, there might be something sinister underlying it. But in recent years, as back pain has been more recognized as having quite significant psychosocial factors, which can seriously, significantly affect long-term outcomes, there's been this idea of yellow flags as well.
Yes.
And I was just wondering if you'd be happy to kind of share a few of those and what they mean to you as a physio, if you're seeing a patient and they have some of those yellow flags.
Yeah. Okay. So we've kind of touched a little bit on this already. So to explain to the people that don't know what a yellow flag is, it's kind of the way I could define it is it's a risk factor for chronicity. So there's been lots of research done into people with lower back pain, and they found that if people kind of hold these characteristics, which I'm going to go into, if they hold these certain characteristics, then they have potentially increased risk of turning their lower back pain into a longer term disability. So i.e. that they're going to have pain for longer. So some examples of yellow flags will be fear avoidance. So if a patient doesn't want to move in a certain way because it hurts, and that they are fearful that that pain is going to make their spine crumble. So I would explain to them at that point that your spine is a solid, robust structure and your spine cannot crumble. Okay, so it's words like if a patient describes their spine as being crumbly, that's a yellow flag. So that's a belief or an attitude. If they're in a lot of distress, so which we know, because I've had back pain and it's highly painful. But if they're in a lot of distress and it's affecting them psychologically and potentially increasing their anxiety, again, that can be considered a yellow flag. So that needs to be addressed. And sometimes that will actually be beyond my scope of practice. And if they've reached a state where I feel they'd be they benefit from seeing like a counselling psychologist, then again that would be my cue to refer them on to a counselling psychologist to discuss their psychological state. And another yellow flag is their expectations. So if they have expectations that they are never going to get better, whatever they do, they are going to have this back pain forever. And we can kind of talk that through, and rationally they see that actually it's quite a new back pain. Then again, that is a yellow flag. So with these yellow flags, this can really help our discussion. And again, it's kind of the physio's job sometimes to dispel some of these misbeliefs. And again, it comes down to lots of education between myself, the GP, potentially the psychologist, and the patient.
I thought that was actually a really, really nice breakdown of it, about that catastrophic thinking. I think from a GP's perspective, there are some almost black and white yellow flags that we look for as well. So if someone's ending up off work for a long period of time, if someone's having significant family issues as a result of their back pain, so breaking relationships, also if someone's showing actually significant signs of mental distress or depression, all of those things also sit within that spectrum of yellow flags for back pain. That's not to say that they're labeling a person. If you're off work with back pain, it doesn't mean that it's all in your head. It just means that the term yellow flag helps us realize that it's not something that should be ignored as professionals. It's something that should be taken extremely seriously, almost in the same way as we take a red flag for some, for something pushing on the spine in a dangerous way. The yellow flag for us is equally, it's more of a psychosocial flag that this person may be at risk of having a worse outcome, and that we need to try to break down some of those ideas with them.
Sure.
Yeah, so I completely agree. At the moment, look, we're in lockdown, and so this is quite a specific time to be doing this. I have the feeling that there's a lot of people who are more active in terms of doing exercise, but are actually less active in terms of sitting at their desks now a lot on laptops during the day, and in the evening kind of sitting in front of the TV. What do you think the implications are during lockdown? And I guess the first question is, what are you seeing now as a physiotherapist? What kind of stuff? I assume you're doing mainly digital or all digital consulting at the moment.
Yeah, all video consultations. And I've had a lot of patients contact me with new incidences of lower back pain. And it's a mixture of components. It's not only the fact that they're now sitting on their laptop, whereas potentially they might be used to a desktop, but they're also lacking that kind of normal structure of a daily workday, whereby they might walk to the station and then they might walk up the stairs to the office, and then they sit at their desk for a bit, and then they'll go to another desk and have a chat, and then they'll go and have a coffee, so they'll go for another walk, and then they'll go out and buy their lunch. So basically, my understanding is that people are being a lot less active on lockdown, even though they might do their kind of one exercise a day. For the rest of the day, they're sitting down in one position for too long at a time. So what I'm encouraging patients to do is to try and recreate their normal working day. So first of all, can they improve their workspace? Obviously, is quite important, but there's actually kind of differing thoughts on the ideal posture. And in the literature, there's a lot of literature that supports this kind of upright posture with 90-degree angles at your elbows and your knees and your hips. But there's another kind of body of literature that supports that actually the most comfortable posture is the best posture. So what I try and advise patients is don't stay in one position for longer than 30 minutes at a time. So for instance, you'd sit for 30 minutes in a comfortable position for you, and then you might stand for 30 minutes. So for instance, put your laptop on the kitchen counter or put it on a bookshelf and do a bit of kind of sit-stand working. Make sure you're walking around the house like you would in the office. Make sure you're going out for your 1 exercise a day. Try and keep your step count up. Try and keep your resistance training exercises in, like is recommended. You know, Department of Health recommend that we all do resistance training. And that's not just, you know, young, fit people. That's everyone should be doing 3 times a week, some strengthening. And just to kind of briefly touch on the fact that a healthy diet and staying hydrated is going to have a really big impact on your spine health as well. So I know kind of people's diets have gone a little bit out the window, but making sure you kind of stay as healthy as you can on lockdown is going to have positive implications to your back pain.
Yeah, I think that's all. I mean, that all sounds incredibly sensible. The one thing I would add, the thing that I find really helpful, because I forget, is stand reminders on my
Yes.
fitness watch, and I don't know how many people turn those on. If anyone's watching who has a Fitbit or an Apple Watch or something and use stand reminders, stick a comment there now so we can see, because I actually find that that's really helpful, because despite my best intentions, I tend to forget. But when it buzzes on my wrist and it says, you know, you've been sitting for an hour, I do tend to get up then and have a glass of water or something like that. I think this has been brilliant. Before we summarize, if anyone's got any questions, put a question sticker up now, and then I can put the question to everyone, and Emma and I can try and answer it. But try and use the question sticker, not the comment, because then I can put it on the. So Louise says, I use a tomato timer app which tells me when to move. Perfect. There you go. Doesn't have to be a silly fitness watch. It can be as simple as a tomato timer.
Yeah,
I completely agree.
And Louise, am I right in saying you can literally Google that, can't you? Tomato timer app into a computer and you get the option. I think it comes up. So it's a really quick and easy thing to use. But for people that don't have technology, I can sometimes just recommend get a little post-it note and stick it on the corner of your computer. And every time you see that post-it note, stand up. Or every time you see that post-it note, just kind of check your posture. Are you in an awful kind of slumped down posture? You know, just kind of switch your core muscles on, change position. You don't need technology.
Fantastic. I completely agree. So look, if anyone's got any questions, stick a sticker on now, or put a question to us now. Emma, what's your kind of summary points? What are your key take homes for everyone watching?
My key take homes, and I'm going to try and keep this simple, is if ever you get an acute exacerbation of back pain, try and keep confident in your ability to move. Okay, so we advocate movement with back pain these days. We don't want you to be sitting at home lying in one position. So keep moving. Speak to a health professional, please. So especially now in lockdown, a lot of people, they're not calling their GPs, they're not calling their physios because they kind of don't think it's important enough. You know, they think that health professionals are just dealing with COVID. But actually, we want to help you. We need to help you now, because if you ignore these things, they can actually be harder to deal with longer down the road. So move, have confidence in your ability to move, and speak to a health professional to help you on your journey.
I completely agree. I think we've got a couple of questions to deal with, but I would echo exactly what you're saying. I say, you know, don't forget there are some serious causes of back pain, so don't just stick it out for weeks on end. You can find reliable resources online on the NHS websites, which you can use to self-diagnose to an extent. But if you're suffering with back pain, which is going on for any period of time, really speak to a professional, either on the phone or in person. Get examined, make sure there's nothing serious going on. Get advice on pain relief and so on, and trust also in the professionals to be able to take you through some of the more perhaps difficult aspects and the yellow flags, and to help you move through it in that way. We've got a question from Ben. Ben Rosty, I've got terrible upper back pain across my shoulders and spending lots of time at my desk. Is this related? What do you think, Emma?
Yeah, well, based on, what I've just said about postural advice, consider your working posture then. Think about, are you moving enough? So I would address that, and then I would address some kind of upper back stretches. We can't obviously diagnose anyone through a little post-it. So, but if you feel it's muscular and you're feeling tight, try some stretches, try some postural management, and then see how you get on.
Okay, brilliant. And there's another one I saw in the comment section, which was quite a good one, and maybe a good one to finish on. And that's from Sandy. What exercise is safe when you have sudden lower back / leg pain? Actually, the leg pain one is interesting, perhaps something to touch on really quickly.
Yeah, but the first thing I'd say there is the word safe. So everything is safe, okay? So movement is safe, and I would advocate that you do some exercise. You try and move your back, your leg, and I would say just don't do anything that drastically makes the pain worse after the exercise. So if you do a kind of a stretch when you're doing the stretch, you're feeling it sore. If that pain goes away as soon as you finish, then I would advocate that actually that's probably okay to do. But if you're doing a stretch and it makes the pain worse at the time, and then you finish the exercise and it's still really painful, then it's probably not the best exercise for you to do at the moment. But it would be something that would be okay to do later down the line. So because, like we touched on at the beginning, everyone is different, it's really hard to kind of say what exercise you should be doing. But if you have typical exercises or stretches that you normally do, I would have a play around with those and see which ones feel kind of good. Do they feel like they're getting to the point? Do they feel like they're aggravating it? If they're aggravating it, just don't do it. Do something else. Sorry, that's so broad, but it's quite hard to kind of be specific.
I think it's quite nice because as a GP, you get quite worried about telling people what exercises to do. So I think it's quite nice to hear that there's flexibility in the approach, and actually a try and see method is fair. I wanted to touch on Sandy's question about leg pain. So pain in the leg, if you've got a bad back, can not often, but can mean that you've got a pinched nerve, which isn't necessarily an emergency, but it's definitely a reason to call a doctor as well. So it's, make sure that you do check out any symptoms, especially if you've got leg pain, which could be something like sciatica, it could be a trapped nerve, it could be something unrelated. Back pain can sometimes be hip pain, which is radiating. So if it's not falling into a typical kind of musculoskeletal back pain pattern, do make sure that you speak to someone and get it checked out. You think that's a good place to finish?
Yeah. Lovely.
Fantastic.
Thank you.
Thank you for joining me, and thanks everyone for joining me. Really, really nice to have so much engagement, and I guess we'll have to do another one soon.
Yeah, nice to speak to you. Thanks everyone for listening.
You too. Bye.
Good night. Bye bye.